At the moment in the hospital, we are seeing anywhere between 5 and 15 flying foxes coming in. So they're the large bat species that we see around Queensland, and they're coming in with something called paralysis syndrome. It's very similar to what we see with the lorikeets at the same time. So they're both coming in all together, often in the same areas as well. Some of the hotspots we have seen at the moment is Toowong area and seeing some in the Queen's Park area in Ipswich as well. Comparable to last year, we did see about 40% of our intake of bats for the entire year in the space of 6 weeks. So that was about 400 to 500 bats coming in that short space of time. That was through some of our really wonderful carers who are going out doing rescues, through ambulance rescues, and also through direct vet clinics as well. There's generally a couple of things that are relatively obvious even to the untrained eye. So bats just in places that they shouldn't be. So they're away from the roost, they're by themselves, they're hanging off of verandas or really low in bushes. They're accessible easily to dogs and cats and even people. If you're able to easily approach them, which, well, don't handle them, but if you can go near them without them reacting at all, that's also really uncommon. You'll often find them not blinking. When they get here, they can't swallow as well. If anyone does find bats that they think are affected by paralysis or injured in any way, it's best to call the 1300 animal number, where we can get our vaccinated rescuers out there, or one of the fabulous bat carer groups. So that could be Bats Queensland, Bats Conservation and Rescue Queensland. The amount of time that they're going to spend in care is really dependent on how bad that paralysis is. Some of them it's weeks to months in care, especially if it's juveniles that are coming in with mothers as well affected by paralysis. Those are going to then span through until the next year as well. They are lovely little creatures, but the amount that we do see does take a lot of strain on resources, especially when also the LPS lorikeets that are coming in as well. They are probably one of my favourite patients to see. They have a lot of personality and they will definitely let you know when they're ready to go. So yeah, I do really love the bats.